Hello, and thank you for joining us for the Using PSYCKES for Population Health Management and Quality Improvement training webinar. My name is Kristen McLaughlin, and I'm the Director for the Medical Informatics Unit at the Office of Population Health and Evaluation. And I'm joined today by my colleague Corin, who will be assisting me in answering any questions that may come in during the training webinar. So let's go in and figure out how you go ahead and ask questions. So, as you may have noticed, all phone lines have been muted to prevent background noise. We do have a little over 200 people registered for today's training webinar. So we are going to ask folks if they do have a question to access the Q&A box in the WebEx menu, and it's located to the right of your screen, or if you've expanded to the full view of the WebEx, you'll just need to hover your cursor over the green bar located at the top of the screen to choose the Q&A option within the menu. We do ask for folks when they are typing in their questions to submit to all panelists, as that will give us the best ability to make sure that we're seeing your question and having a chance to answer it. Sometimes people, when they submit to presenter, I may be busy presenting and I might miss your question. So if you want to make sure that we see your question, please submit to all panelists. And we do ask folks not to use the chat function for Q&A, as that will be not monitored during today's training webinar. One other additional note that I'd like to make is that due to the fact that we do have around 200 people registered for today's training webinar, we're going to run through all of the slides to make sure that we have enough time to get through those. And then at the end, we will open it up to questions. So if there's a potential that your question does not get an opportunity to be asked live on air, please know that we are going to be saving all of the questions, and we can follow up with you after today's training webinar to make sure that you get the answer that you need. As well as that follow-up, we are going to be sending slides and the recording link to all attendees after the training webinar, and we will also be posting this training webinar to our website in the next couple weeks. So without further ado, let's talk about today's agenda. So today's training is part of a series in which we worked with OMH program Meredith Ray Labatt and Sarah Kyriakos for the Division of Integrated Community Services for Children and Families. And this training webinar series was designed to identify how children programs could utilize PSYCKES in their work with children and families. So today's training, we've done two other trainings previously that was really focused on the individual. So looking at how to get access to client level data and how to view the individual clinical summary. But for this training, we're going to be focused on two items, the population health management portion as well as quality improvement. So for population health management, this is going to be reviewing how to run reports to identify recipients you're surveying who are, maybe engaged in children HCBS, CFTSS, health home or other services, children who may be eligible for services using the children waiver. We have the children waiver K code. Children who have medical comorbidities for specific risk factors such as high hospital utilization or a history of suicide ideation or self-harm, homelessness, and transition age youth. And we'll also talk about how to review this information in one of our bulk population advanced views. And then for the quality improvement, that's going to talk about how to track performance on an array of quality measures, such as psychosocial care for kids on ADHD medications, how to screen for diabetes, or engagement in care after hospitalization. So these are just some of the flags that we'll be going over, and then we'll make sure to leave time for training and technical assistance as well as question and answers. So without further ado, let's start with a PSYCKES overview. So for some folks who might be on the line, you might be really familiar with PSYCKES. Other folks might not be as familiar. So this PSYCKES overview is just really top of the trees, broad information about the application. So what is PSYCKES? The PSYCKES application is an online web-based application that can be accessed on any internet browser, and it's secure and HIPAA compliant. And the purpose of the PSYCKES application is for sharing data, right? It's for sharing Medicaid claims encounter data as well as other state administrative data. So what does PSYCKES do with all of this data? So what it does is it puts it into a user-friendly format, and it's designed to support clinical decision-making on the individual level, as well as quality improvement on more of that provider population trend level, because you can use the data that's collected in the application to make plans, to identify potential problem areas, et cetera. And then in regards to our updates, our clinical summary, our individual clinical summary report, we're able to update that on a weekly basis, whereas the MyQI reports, which is the report that identifies any of the potential quality flags an individual could have, that gets updated on more of a monthly basis. All right, so now that you know what PSYCKES is, which of my clients are going to be viewable in PSYCKES? So in order to be in the PSYCKES application, an individual needs to be considered a Medicaid enrollee, whether they're either currently or previously enrolled. And the thing to keep in mind is that people who are currently uninsured may have been enrolled previously in Medicaid. So once in, always in. That's good to think about. So what do we also mean by Medicaid enrollees? That's including across all the categories, including fee-for-service and managed care. We also include the dual eligible. But something to note about that is that for dual eligible, so that's Medicaid and Medicare or Medicaid and commercial, we would only be able to display the Medicaid data at this time. So if Medicaid pays for any part of the service or for the medication, PSYCKES will pick up that information. But if it's Medicare that's paying for it, unfortunately, that's not something that we'd be able to display, but we're definitely working on adding that as a data source in the future. So in addition to being a Medicaid enrollee, in order to be in the PSYCKES application, an individual needs to be a member of the behavioral health population. And what does that mean? That means that the recipient has had either a history of a psychiatric or substance use service, a psychiatric or substance use diagnosis, or has been prescribed a psychotropic medication. So currently at this time, we have a little over, I think we might even be closer to 11 million of the New York State Medicaid behavioral health population that's available within the application. But just because it's for the behavioral health population that's going to be the viewable folks doesn't mean that the information about that population is going to be strictly limited to behavioral health. In my next slide, we'll go into more detail about that. So let's talk about the data that's going to be available in PSYCKES. So as I mentioned, the clinical summary is updated on a weekly basis, but it provides for one individual up to 5 years worth of information. And we're getting information from two different kind of data source buckets, if you will. So one is the billing information, which is our largest data source. So that's all of the Medicaid fee-for-service claims and managed care encounter data across the treatment settings. So this is including information about medications, medical and behavioral health outpatient and inpatient services, ER visits, care coordination, residential information, labs. If Medicaid pays for it, we'll be able to display it. So that's our largest data source. But something to keep in mind when we're thinking about our largest data source, which is the Medicaid claims information. There's going to be a time lag associated with that information. That can vary on a couple of different things. So first, it's going to depend on the type of information. So something like pharmacy claims, we actually consider that pretty quick and timely. It could be anywhere between 30 and 45 days, a little bit more, a little bit less, from when the time the person picked up their prescription to the time that's available in the PSYCKES application. Whereas things like inpatient and outpatient services tend to take a little bit longer from the time that the service actually occurred to the time that you're going to see it in PSYCKES. On average, it's around 3 or 4 months, but again, it could be less, but it could be more. And that's going to depend on a couple of different things. So first, it's going to depend on how quickly and how accurately the provider themselves bill for the service. So if there's a process at your agency where we submit our claims at the end of the month, and this service occurred on the first of the month, you're already adding 30 days, right, to that lag. It also, if it's not adjudicated, right, it gets sent back. That's also adding time to that said claim. So the provider needs to first submit their bill, and let's say it's going to the managed care plan. The managed care plan then needs to take time to review the information, and then they decide to submit it to the Department of Health. So it really does depend on how quickly each of these organizations turn these claims around. But once the information is captured at DOH, that's where we're getting our weekly feed of Medicaid data from. And so that's why we say we update weekly, because we get that weekly feed from DOH. It just really, the lag occurs by the time that it actually shows up at DOH. So we do have another data source bucket, and this is what we consider our quote-unquote more real-time sources, because this is information that we're getting from other state administrative databases. And the lag here is anywhere between 0 and 7 days. And as we mentioned, we update weekly, so that's why we call these our quote-unquote real-time. So what are some examples of these data sources? So if a recipient has had any shelter or outreach information for the New York City Department of Homeless Services, we're capturing that. That's one of our newest data sources. So we'll be able to identify shelter information, how, like if they're currently there, if they've been there previously, where the shelter was, even contact information. We also have the state psychiatric EMR. So we get a direct link to their EMR, which is called MARS. And so if an individual had to stay in a state PC, we're able to pull that right in. If someone has ACT provider, is part of ACT and you want to have provider contact information, we're getting that from CARES. We're also getting OMH designated housing from CARES. So if it's not paid for by Medicaid, but we do have that OMH CARES database, that's another thing that we're able to see. We also have AOT information. So if somebody has an AOT court order, we're able to show you the provider contact information there as well. Health home enrollment and CMA provider contact information. So if your client is part of a health home and a care management agency, you're going to get that information in the application. If there's been a suicide attempt, and this is something that's a little bit different from the Medicaid information, because the Medicaid is limited to that 5-year look back, whereas NIMERS, which is the state's incident management system, that is going to have the breadth of history, right? So as long as we have access to the historical information in NIMERS, we'll be able to display it in PSYCKES. So for example, if someone had a suicide attempt 8 years ago, 10 years ago, 12 years ago, if it's indicated in NIMERS, we'll be able to display that in the application, since it's such a critical piece of information. We also have the managed care plan and HARP status, so that's our children waiver status, so that's information that we're able to also get. Also, if there's any safety plans or screenings and assessments that have been entered in either by clients or providers using MyChoice or the iOS version of the mobile app, that will also be displayed in the application. And then if the person happens to have a managed care plan assigned PCP. So we're constantly adding new data sources to the application. And then lastly, we have our quality flag. So this is PSYCKES identifies clients flagged for a particular quality concern or treatment issue that is deemed worth scrutinizing, right? So we have these flags. We have about over 80 at this point. And what happens is when someone's getting flagged, it lets the treating provider know that this person is hitting this flag and helps them support clinical review and quality improvement. The other thing that a quality flag will do, if it's applicable and not an enhanced protected health information flag, for instance, if an individual that you're serving has a positive applicable quality flag, you as the provider are then allowed to look at the individual's clinical summary. It's not going to be the full picture. It's not going to include enhanced protected health information, for example, but it will allow you to see the details that you would need to see in order to treat the applicable quality flag that you're seeing. So what are some examples of some of the quality flags, especially related to children? So we have our vital signs dashboard for children. So if they haven't had a well care visit in the past year, or there hasn't been immunizations, for certain vaccines, right? So that's going to be indicated. If there's medication-related quality flags, so there hasn't been a follow-up after a child has been placed on an ADHD medication. Acute care utilization, so if someone, or if a child is, increasing their use of ER or inpatient services, or cycling in and out of a hospital with readmissions, that's something that can be identified. So these are just some of the examples of the quality flags that we have available in the application. So let's talk about some of the reports that are available. So as I mentioned, we have the client clinical summaries, which will show individual client data up to 5 years. But then we have our provider agency level reports. So what are those? So we have the recipient search reports can be used to identify cohorts of interest to help support population health. we have the My2I reports, and that can be seen, you know, your current performance on all of the different quality indicators with the ability to drill down to see the client level views. So not only seeing the counts of the people with these flags, but also their information. So you can drill in and look at their clinical summary and figure out how to start addressing maybe some of those flags. We also have usage reports, and I always put these in the slides, especially when we're doing trainings like this, just because, you know, you're taking time to learn an application. So you want to make sure that if you or your staff are taking the time to learn it, that you're using it, right? If you don't use it, you lose it. So this is a way that you can, if you decide like we want to start implementing PSYCKES at our agency or at our clinic, you have the ability to use the PSYCKES usage report to not only monitor PHI access by staff, but also see who's logging in. Really, it does have to have that buy-in in order for people to use it. And then we have utilization reports that help support provider value-based payment data needs as well. And then lastly, we have these statewide reports. So here you can show how your agency is successful at addressing particular quality concerns, especially when you compare yourself to the prevalence rate on quality measures across the region, county, plan, network, or even other providers going head to head. So I have these two underlined because these are going to be the reports that we're going to be focusing on today's training. All right, so before I jump into recipient search, I do want to also mention, just in case we had any folks join the line a little bit late, is that today's training webinar is going to be recorded, and we are going to be sending the recording link as well as the slides to all attendees who've joined us today. All right, and we're going to be saving our questions to the end. All right, so moving on to recipient search. What is recipient search? So this is the look of recipient search here. You can see that you have the ability to either search for one individual person using this box in purple up here. So you can see up here, you can search by someone's Medicaid ID or social security number, which is a unique identifier, or you can search by name and date of birth, a combination of this. If you're using anything in these top boxes here, that's for looking for an individual person. Where we're going to be spending most of our time today is in the group search option. So that is what you're seeing all down below here. And if we continue scrolling, we would see even more. And these are organized by certain sections. And so here you have the ability for people who have been served by your organization to look at this information and see, like, who have I served who has X, Y, or Z, right, or X and Z. So that's how we utilize this section here. So I'm going to take the time and go over each of the sections point by point and point out some certain filters that you as a child provider may be interested in running. So starting at the characteristics section, all the way located up at the top here. So first thing you might notice is the age range, right? So you have the abilities, let's say your organization serves, you know, a variety of different types of clients, but you want to focus on the children specifically. You could always indicate an age range here. So you could say like up to 18, or you could do an age range of, you know, 13 to 25, right? Whatever age range you'd like, you have the option to do that here. And along with all of these other different filters, one that I definitely want to point out is the high need population. So the high need population filter could be really useful to identify certain people at your organization who have a particular need that might need to be met or might need to be looked at a little bit closer. So there's a couple that I identified here just because I knew that they were related to children. So let's start with the On-Track. So On-Track Early Psychosis Program. So if the person has been enrolled, has been discharged in the last 3 years, or has been enrolled or discharged in the last 3 years. So On-Track NY is a mental health treatment program for adolescents and young adults. I think the age range is usually, is 16 to 30. So basically, these are individuals, adolescents or young adults, who have recently had, you know, unusual thoughts or behaviors, maybe started hearing or seeing things that others don't. So this program is to help them get there right in the beginning and help people achieve their goals for school, for work, or relationships. So this is something that you'd be able to see in the clinical summary. Or if you want to use the recipient search, you can see how many of my clients are enrolled in an On-Track Early Psychosis program. That's something that you can do in the recipient search. Another thing that we have here is the transition age youth for behavioral health. So that's going to identify people who are going to be transitioning out of youth services and moving into the adult services. Maybe that's something that you'd want to be able to identify. Who at my organization is considered a transition age youth? So that's usually people who are 18 to 25 and they are health home enrolled for a behavioral health reason. They've had some sort of RTF or community resident treatment, has had, you know, maybe a behavioral health hospitalization or a state PC hospitalization, right? So there could be a couple different risk criteria that people are identified as in the transition age youth. So, and that was actually, that was signed off, that criteria, by Meredith Ray Labatt, as well as some other folks at OMH. So that's something to identify, and you have the opportunity to do so within the application here. But as you can see, there's plenty of other things that you could maybe be interested in regards to the high need population, right? So maybe you're also wanting to know if any of your clients are OPWDD NY START eligible. Maybe you want to know if any are core eligible or any are considered high Medicaid costs for inpatient or ER. And this is in the state, so top 1%, top 5%. There's a lot to choose from just within this one filter. So this is definitely a filter to become friendly with and aware of. What's another filter that you might be interested in regards to the characteristics? So here's the alert filter. So if you want to identify who at my organization has had a suicide attempt in the past year or any suicide attempt, or has any suicidal ideation or self-inflicted harm and poisoning, you have the ability to select any of those here, as well as any of the opioid-related alerts, or if someone's been placed on a registry. I do want to note that the opioid-related alerts, those are considered enhanced protected health information. So just, you know, referring back to my previous training to a part of that series, it's always really important that when you can, getting a consent in place, because that's going to allow you the fullest level of access. So you have the ability to search for that information within this drop-down list as well. Underneath that, we have homelessness alerts. So if you wanted to know who at your organization has any history of homelessness, whether indicated in billing or for the New York City Department of Homeless Services, you also have that ability to look there as well. So moving on from the characteristics, we're jumping down to the managed care plan and the quality flag section. So the very next section is the managed care plan and Medicaid. And over on the far right here, you see children's waiver status. So this is going to identify members enrolled in the HCBS children waiver that have recipient restriction exemption codes, also known as K codes. And this is going to indicate which children are enrolled in waiver services and their specific population category. So you hear that we have if they're part of any, and then we also can do it by the specific. Like if you want to know the specific HCBS serious emotional disturbance K3 codes, you could search your organization to see which of my recipients have this waiver status. Over on the left-hand side here, you have the quality flags. So what's nice about the recipient search is that you're able to layer all of these different filters on top of each other, right? So if you really want to like find this really specific type of cohort, you can always add the quality flags as well. Like I want to know who of my K3 folks have this quality flag. You have that ability to run that search because when you're using things in the recipient search that aren't within the same box, so if I, for example, did K3 and selected a quality flag, that's going to create an and logic. Whereas if I'm selecting within the same list, so if I selected two flags from within the quality flag section here that are related, like maybe I'm interested in all of the immunization flags, if I selected each of these three, if it's within the same list, it's creating an OR criteria. So what that would do is I would be looking for any of my recipients who've had no HPV, no meningococcal, and then no Tdap. So like that's going to be something that I can do within the list. That's the OR, whereas between lists, that's an AND. So I just wanted to mention that right there. And then here, I'm just highlighting some of the children-related quality flags. So you have the ability to choose from there. I will also share that you can select up to 4 in one list. All right, so then scrolling down the page, so we talked about the managed care plan, we talked about the quality flag. Now we're going to continue to scroll down on the page, and the next section we're going to be talking about is the medication and diagnoses. So here at the top, this is where the medication information is. So if you want to know who at my organization has been prescribed this specific drug, you could actually type in the name of the drug, and it uses a fuzzy logic to match. Or you could search by a specific psychotropic drug class. So if I want to know who at my organization has been prescribed an ADHD med, I have the ability to choose that just from selecting this drop down here, or any non-psychotropic drug class. So here is where you're able to look up medications. And then below that, that's where the diagnoses come in. And those are separated between the DSM-5 and the ICD-10 for medical, and this is the behavioral health related. So you have the opportunity, and something that I'm pointing out here is that each of the diagnoses is a tree. So you have the ability to select the dash on the side to open up that tree. So I can see all of the neurodevelopmental disorders. I could search for any client who has a neurodevelopmental disorder, or I could maybe want to refine my search, and I just want to know who at my organization has ADHD, who has been diagnosed with ADHD in the past year. And you'll see that the past year is the default up at the top. So that's another example in which you're able to do these. And you can do, again, with medical diagnoses. If you don't want to use the trees, you also have the ability to type in the diagnosis. So if you want to type in a specific type of diagnosis, it will use that fuzzy logic to identify that. And you have the ability, so these all belong to one another, whereas these lists are separate. So if you type in a diagnosis here, you could also say, I want to know who's been diagnosed this, but diagnosed this at least 3 times or at least 5 times. So I can feel pretty confident about the diagnosis per se. And you can also identify if it's a primary or secondary. So that's in the medication and diagnosis section. If we move to the right of the recipient search, so you're just getting just a brief idea of just how dense the information in the recipient search is. So moving to the right, if you're logged in as your specific program, right? So in this case, I'm logged in as Main Street Clinic. Being logged in as Main Street Clinic, the service settings that are listed underneath here are going to identify only the services that I myself are billing for, or if I'm part of a health home or care management agency, if it's something that's related to me at MAP, that'll show here. So in this instance, Main Street Clinic, I'm providing living support residential services as well as outpatient MH services. So what type of services am I providing? So here are all the CFTSSs, so the Child and Family Treatment and Support Services. Those are services that enable a greater focus on prevention and early intervention by providing an array of Medicaid benefits that offer opportunities to, meet behavioral health needs earlier in a child or youth's life. So just in order to prevent the onset of progression of behavioral health conditions, right? I'm sure everybody on the call is relatively aware of what CFTSS is. So if I want to, maybe Main Street Clinic, I'm not associated with the living and residential program, but I am associated with the CFTSS services. Maybe I only want to run my recipient search based on that population. So you have the ability to select, and again, you use that tree option of like selecting that little dash on the side to open up the tree. Beneath that, I'm also apparently my Main Street Clinic is also offering children's HCBS services. So these HCBS services are designed to offer support and services to children in non-institutional settings that enable them to remain at home and in the community. So I also, those are the services that I'm associated with at Main Street Clinic, so I could make a selection there as well. So that's just one example of how you can use the services by the specific provider. Something else that I want to mention is that if you're interested in who at your organization, or who, not at your organization, but which recipients have a PSYCKES consent, because you want to know if you have the fullest access, you also have this current access drop down. So this is going to let you know if there's how many people you have PSYCKES consents in place for, how many people that you've attested to a clinical emergency, who you've gotten a verbal consent from, even who's just been automatically attached to you via billing. So that's just a couple of the other things that you can see within the services by a specific provider, which will be your name here. When you scroll down underneath that, you can look at services by any provider. So by any provider. So this, you could even type in a provider name here, or if you want to be like, I want to know what services my recipients are receiving in this particular region or in this particular county. Before I go into this box here, you could do by service setting. So if I want to see which services my clients are receiving, maybe I'm interested in seeing which of the organizations are providing my recipients with some children waiver, you know, community habilitation or pre-voc services or respite, et cetera. I have the ability to open up this tree under care coordination and select children waiver services, right? So I could see who has been providing my clients these services across the state. And then lastly, I just want to point out the service utilization, because that's just one of the examples. Maybe I'm really interested, Main Street Clinic isn't a hospital. I want to know who are my highest utilizing folks that are going to the hospital. This is where these sister filters come in, because they are related to one another. So for example, I could choose, I want to see out of all of my recipients, which have had an ER visit in the past year more than 5 times, more than 10 times, up to 20 times. This is going to really help you identify those really high utilizing folks. And this is, besides using the quality flags, this could even give you like a specific amount. You can see 20 plus is quite a lot. And then one last thing that I want to point out about the recipient search is that it does limit the result to 50. That's the default. So if you're a larger organization and you're running searches and you know that, 100, 500 names are going to come back, just know that you're not going to see all 500 names unless you expand the results to a larger cohort search. So that's just something to keep in mind. So here's an example search that I ran. I wanted to know who at my Main Street Clinic has any children waiver status. So out of all of the recipients I have at Main Street Clinic, I have about 43 recipients who have at least one of the children waiver statuses. So then below here, and again, because this is a training, this has been de-identified, so no client identifying information, right? But normally, if you're logged in, what you're going to be seeing is the individual's name, their Medicaid ID, their date of birth, their age and their gender. So this is all going to be identifiable, as well as what Medicaid quality flags that they have, what their managed care plan is, and then what your level of access is to their data. So you can see here, for instance, you have no access to this person's data. So that means that you do not have what you need in order to view this person's clinical summary. So here's an example of a non-applicable quality flag, that this person just has a high mental health need. That's not an applicable quality flag that will allow your agency access to this client's clinical summary. So this would be, if you wanted to see this person's information, you would need to get a consent in place, or somehow manually attest that a verbal consent was done, or even ER, depending on what it is. But that's one of those examples of why consent is king. Another thing that you can do is you can export this. So you could run a specific search, export it to PDF or export it to an Excel to do any data manipulation that you might need to do, or you just have a list that you need to provide your staff, being like, these are the people that we need to do X, Y, and Z with, right? So that's just another example there. One last thing I'm going to point out is going to be this view option, and that's going to be really important in a moment, because one of the things that we've heard from our users is 43 recipients found. Now I know their children waiver status, they have one, but how do I find out what it is? Do I have to drill into all 43 people? So that's where the bulk population management view comes in. So the bulk population management view, we also call the advanced views. This gives users the ability to look at your results page through a different lens. You can look at them through the care coordination via the high need, high risk, hospital utilization, and outpatient providers. So this will adjust the certain information that you're able to see on the results page to align with the specific advanced view that you've selected. And it's going to allow for multiple columns to be added to that view. And depending on what view you're selecting, you're going to see additional information. So for example, for care coordination, if I choose the care coordination view for one of my searches, that will also show me what people's HARP status is, if they're core eligible, their managed care product line, their children waiver status. So that's answering that question I was talking about before, right? If they're part of the early psychosis program, right? And then we have the AOT and ACT. We also have the high need, high risk. So if this person's considered a transition age youth, OPWDD NY START eligible, Health Home Plus eligible, have had a suicide risk or an overdose risk, hospital utilization. So all of the people who've had a children waiver status, I want to break down and see the number of ER or inpatient behavioral health or medical visits they've had in the past year, and I could get those counts right on that one view. And then outpatient providers, I want to see who has been serving my clients that had children waiver statuses in the past year. So you have the ability to look at the primary, the PCP assigned by the managed care plan if applicable, who their mental health outpatient providers are, their medical outpatient providers, if they have any core or adult HCBS services, right? So these are all the different ways that you can look at those searches without having to drill into the individual clinical summaries to get the data that you may be able to get in a bulk population management view. So for today's training, we're going to be looking at the care coordination view, but feel free, again, to play around when you log into PSYCKES to look at some of these other ones to see if those are going to be helpful. All right, so we're going to change the standard view, which is going to be all of this information, and we're going to change it to the care coordination, right? So my search is still here, but now I'm seeing of these 43 people found, which of them is enrolled in a managed care product line. So I see there's a lot of mainstream here. I can see the current PHI access, right? And then I have the ability at the below here to scroll to the right to see additional columns with data. So I'm going to start scrolling to the right. In the next few columns, I can see the HARP status. I can see the core eligible if they are. I can see the HARP HCBS assessment date, but then look, this is exactly what we were talking about today, is the children waiver status. So we ran a search saying, like, who of my individuals are, have any children waiver status? These are the 43 people found. So in this column, I get to see what specific K code they have. So multiple K3s, but we also see family of one. We also see medically fragile, right? So we're able to get this information. And again, just another note, for these two, we don't have access to their information, so we don't get to see their data. So another plug for consent. So if I keep scrolling to the right, and again, you keep the name in view so you're able to see who has what continuously. You keep scrolling to the right. I can also see, okay, what health home are they enrolled in? What care management are they enrolled in? Do they have an ACT provider? And then are they enrolled in the On-Track NY Early Psychosis program? So we see that two of the clients who have a children waiver status are also enrolled in the On-Track program here, as well as whatever their health home information is, and care management if they have it. And then I didn't do an additional slide, but there are two additional columns that have to do with AOT. So if they have any AOT provider and court order information, that would be if we kept moving to the right here. Now, I just want to point out that you have the ability to export this, right? So you can export this to an Excel, and you have the ability to then, maybe you want to add some more columns. Maybe you have data about these clients that you want to create your own table for, and you can base it off of this and add your own information. So again, all of our reports are exportable, and this is just one easier way for users to be able to, utilize the recipient search to do that population health management. All right, so now that we've talked about recipient search, let's move on to the MyQI report. So what is the MyQI report? So it's a tool for managing quality improvement efforts, and we update this on a monthly basis. So within the MyQI reports, we display the eligible population, which is also known as the denominator. So for each of the different flags, there's going to be an eligible population, and this is going to be the number of clients that were served by your organization in the past 9 months, plus other parameters that are based on the quality indicator specifications, right? So eligible population that, for some of our medication-related flags, part of the eligibility would also mean that you have to be part of Medicaid, because we will only be able to see medications paid for by Medicaid. That's an example of one of the additional parameters, depending on the quality indicator specification. And again, each of the quality flags have their own specifications and can differ flag to flag. So it's really important to look at those technical specifications, and those are available on our website. Now that we know what the denominator is, let's talk about what the numerator is. So that's the number with the quality flag. So that's the number of the individuals who are who have that quality flag, and they're meeting the criteria for that specific quality flag. So then next you have the prevalence rate. So really that's just numerator over denominator. That's where we're getting the prevalence rate from. And in the MyQI report, you can compare your prevalence rate with that of your region and of the state. So in PSYCKES, we have, the bad news, right? Like, we're telling you the people who are getting, who have these quality concerns, treatment issues, medication adherence problems. So what you want to see when you're looking at PSYCKES is that you want to see the prevalence rate go down over time, which may be different from other applications that you're using. So the lower the prevalence rate is, the better that you're doing towards that specific quality flag. A high prevalence rate indicates that there's an opportunity for improvement. So if you're seeing that your prevalence rate is higher than rates in the region or the state, that might be an area that you'd like to focus on. You also have the ability to filter the MyQI report by program type, by managed care plan, by age, and by county. All right, and then we also, for any of the folks today who are also, kids provider, but also have a health home or a care management aspect to your organization, we do have a special tab called the Health Home Care Management Sites tab, which breaks out the QI prevalence rate by health home or care management agencies. And we're able to link clients according to MAP to those different sites. So for health homes, you're going to see, if you're a health home, right, you would be able to see the breakout of prevalence rates for all the different care management agencies underneath your health home. But if you're a part of the care management agency, what you're going to see in this tab is the breakout of the clients that you're working with at your CMA and all of the different health homes that you're associated with. All right, so, and then just one other thing, I think I've mentioned this previously, when you are able to see these counts, right, you see this is the number of people who are hitting this flag, this is my prevalence rate, you have the ability in the MyQI reports to then drill down into the client name and then also look at their clinical summary to see what you can do to address that flag. And as with all reports, you can export to Excel. All right, and so before we look at some of the screenshots, because sometimes, picture's worth 1,000 words, I just want to make sure that we have the understanding of the MyQI report itself. So one of the things we want to make sure that folks are understanding is how clients are going to be attributed to your agency in the MyQI report, right? We were saying that 9-month look back before, right? So clients can be attributed to your QI report through billing. So clients are going to be linked to your provider agency if they've been billed by your agency in the past 9 months. Or if, again, we're talking about the care management agencies and health homes, or this can be done in MAP. The MAP Health Home and Care Management Database links clients to a provider agency if they're enrolled in a health home or care management agency according to MAP. So why is this rule in place? And this rule is in place because it's going to assist in automatically linking clients to providers so that current clients are included within the report each month. So this is to help. So if you have a client who comes in 1 month, doesn't come in another month, comes in again, doesn't come in for 2 months, they're not bouncing on and off your report. So it's going to be, if someone's on your report, even if they've just come in once or twice and you've billed for it, they're going to stay on your report until the 9 months have elapsed or they're no longer hitting the criteria for that said flag. All right, so let's talk about the flags, right? Let's talk about the period of observation for quality indicators. So this is assessed by a measure and varies for each measure. So for example, the period of observation and the period of observation for, let's say, the high utilization quality flags, right? So even though the client has to be linked to your organization via a bill in the last 9 months, in order to get flagged for high utilization, that means they've had to have 2 or more hospitalizations in the past 13 months. So that's just something to think about. There's a difference between clients being attributed and the period of observation. So those are the two ways that someone's going to get quote unquote flagged on your MyQI report. We also have a quality reports trending over time called the QI Trends Past Year Report, and that will show prevalence rates on quality flags by provider over the past year. So if you want to see, like maybe you started an intervention plan for dealing with people who are on, children who are, not getting the follow-ups after, being placed on an ADHD medication. You could set up a plan and then see if that intervention is working or not, because you can look in the past year and see like, okay, we started this in January of 2023. Let's see where we are at the 6-month period. Are we tracking down, which is the good news, right? We want that number to be lower. And my next slide will go into more detail about that. All right, so this is what the MyQI report looks like. And so for any of our OG members, they might see like, whoa, this looks really different. So we've done something in the past month where we have reorganized the indicator sets, and we divided them into 2 categories just to help make it easier for our users to identify between the quote unquote real-time measures versus the mature measures. So up at the top here, these are the quality improvement indicators. And these are the category and are considered real time and are run on a monthly basis as of the refresh date. So I'm showing an example of what our QA environment looks like. So right now, that's why we're seeing the, might be hard, my WebEx menu just came down, but you'll see the 3/1/2023 as of report date, right? So 3/1/2023. And that's because I was using the QA environment. Currently in our application, we just had a refresh, so that's going to be February 1st, but this is coming out later this month, so that's exciting. Beneath that, we have the performance tracking indicator. So this is the indicator sets in this category contain more mature measures, and those are calculated monthly after a 6-month data maturation period. And this is to allow for services to be invoiced, right? I've already mentioned this previously in the webinar. It could take upwards of 3 to 4 months from the time that a service occurred to the time that it actually, like the bill becomes available at the Department of Health. So that's why the Department of Health has this 6-month data maturation period to make sure that if a service happened, we're giving 6 months for us to be able to get that information. And this indicator set is separated, will also be reflected in our statewide reports and our client level, clinical summary, quality flag section, et cetera. So one thing I do want to mention is that for folks who have logged in, they might have noticed that the mental health performance tracking measure and the FUD performance tracking measure sets, these were recently renamed, but because we are adding some new quality indicators in this set, they were hidden just for this month. So just for March, we had to hide these 2 indicator sets because these are run by the Department of Health, and we're in the process of adding new DOH quality measures. So these should be available at the end of the month during our next release, and we do apologize for that inconvenience, but hopefully folks will be excited to see some of the new measures that we have in there. All right, so that's how this is split. I'm going to focus down, just for an example, on the vital signs dashboard for children. So I'm going to zoom in here, and this is a summary measure indicating the number of unique individuals who meet the criteria for any of the vital signs dashboard child indicators. And most of the measures are set and are calculated by the DOH run measures after that 6-month maturation period. And the measures run monthly on all available data as the run date that don't require the 6-month maturation period would be indicated in their hover over text. So we'll see that once we drill in. But before we get into that, here's where you can see. So Main Street Clinic, this is the population who's included in this indicator set. These are the people who are eligible. So these are the people who are eligible at my organization who I've served that may be eligible for one of these flags here. Here is the numerator, right? These are the people who are actually getting this flag. So 700 people have one or more of the flags within the vital signs dashboard child. So that prevalence rate is about a 29. So I compare that to the region and the state, and that's good news, right? My number's lower than both of them. That means I'm doing well in this case, and I can compare it via a graph here. if I want to see all of the different indicators within this dashboard, or within this indicator set, I would just simply click on this. So now I'm viewing this information. Here are all those different indicators that are available within this one set. And here you can see the eligible population per indicator, per flag, and how many people are hitting that. So here's an example for the no follow-up after a mental health ED visit after 7 days. There was no follow-up done. Who's available to have this flag? This is the population that will be included. Here's the eligible population. Out of that 180, a little over 60 have that quality flag. Here I see the number is 33, the region's 32, and the statewide's 30. So this might be like, oh, even though overall I'm doing pretty well with the vital signs dashboard, maybe there's some work for me to do here in this regard. So this is where I can look at this information. So when I drill into the indicator here, there I'm going to see the 61 people who are hitting that flag. That's what this is going to show me. So I'm going to click in on that. And here, this is where the recipients are going to show. And I can look at all of the recipients. I can see, and again, this is de-identified due to today's training, but you can drill into the recipient information, their Medicaid ID, their date of birth. You also have their race and ethnicity that's coming from the Medicaid information, any other quality flag that they're positive for, and outpatient attending, and last time the clinical summary was viewed. So you can click on the client's name. I want to see, okay, this person has this flag. I want to drill and see their clinical summary, or this person has this flag. I want to export this list and provide it to my staff so we can start addressing this information. That's one example. You also have the ability to filter these reports. So let's say Main Street Clinic is a huge organization, and I only work in the CFTFS. I want to see how my program is doing in regards to the region and the state. Maybe we're doing a really good job with some of this stuff. So I want to only see, I want to filter this for only people who are providing these type of services or within this age range, right? You have the ability to search and filter your report using any of these QI filters. So I'm going to do an example of the CFTSS. So I put that filter down. Do you see how these numbers have changed? So now they're much smaller numbers, right? Because we're only looking at this one program that's part of this. And then this is the top, the quality improvements, right? So here I can see like I'm doing better than average in the polypharmacy here, but I do need to improve on, let's say, you know, the health home care management stuff or the general medical quar, right? Like these are what these graphs are here to show you. Another thing that you can do is the trends over time, and that was what I was talking about before. So let's say that I had a plan at the very beginning of, you know, the year, being like, I'm going to work and make sure that the kids that I'm serving, there's no antipsychotic, like 2 or more antipsychotics in 90 days for children. I want to make sure that that's not working, that's not happening anymore. We're going to put this implementation plan together. So here I could see like, you know, relatively similar to what we're doing comparably to the region and the state. Then I got a little high, then then a low, and then there was an increase. So that could be like maybe where I said like, whoa, we need to rate the ship here. And then all of a sudden you see the decrease happening. So that's what this graph is telling us. It's telling us a story, and it's letting us know how we're doing in regards to this. And then you can also come down and see here, like when you're looking at this graph, like, oh, the numbers are actually pretty small. Only 12 of our individuals are having this issue, or like per month, right? Like so 3-1, 4-1, 5-1. The table beneath will show you more of the tabular information, where above you're going to be able to see it in a graphical way. And you have the ability to filter as well in here. All right, so I know that we only have a few more minutes, so I'm just going to make sure we get through the statewide reports. All right, so this is going to provide a color-coded New York State map and aggregate data that highlights variations in prevalence rates for particular quality indicators. And it's available not only for the region, but for the county, the network provider, even the managed care plan level. And what I really like about this is that the provider tab allows you to compare your prevalence rates on a selected measure for each provider. So you have that ability to like really compare apples to apples Like, you want to see for this indicator, how are these other programs that are providing X, Y, and Z services, how are they doing comparatively to us? And again, you can export to the PDF. So again, here's an example of like what I was looking at just before. Like, I want to see how we can do, how we're doing with our CFTSS program. So this is going to be me comparing across the state other organizations that have CFTSS programs and see how I'm doing comparatively. So, right, I make my selections, and that's one other thing I should have added, that you have to make a selection for indicator set and indicator type, whereas everything else is optional, but I want to do the apples to apples here, right? So here, this is where I land. You can see the colors. That's where these programs are occurring right now, and enough where percentage where you can see the different color orientation. Here's the region. Let's say I want to look at the provider, right? So now I can compare myself and see, like, comparatively across the state who provide CFTSS services, how am I doing? And I can look at the rate high, right? So I can look at the prevalence rate. And if my prevalence rate is lower than what I'm seeing here, I can feel pretty good about what I'm doing. If I'm seeing that it's higher, that's just letting me know I have room for improvement and what I can do next. All right, so I'm going to quickly go over some of our training and technical assistance. Our PSYCKES training website is a just treasure trove of information. So that's at psyches.org. So you can come to live webinars just like you did today, or you can, if you don't have the time or the schedule doesn't work for you, you have the opportunity to listen to some of the recorded webinars that we had. So if you're brand new to PSYCKES, Introduction to PSYCKES would be a great place for you to start. It's really top of the trees. You're not going to get all of the information because you can see we went to practically the hour just going over, you know, a couple of our different reports today. So you can see each of these webinars, you can do a deeper dive, like using PSYCKES quality indicator reports, or using the recipient search, or using the clinical summary, or understanding more about the levels of access. Or if you're one of these children HCBS services, right, you're meeting clients out in the community, maybe you might benefit from the PSYCKES mobile app. And the great thing about the mobile app is that you can take PSYCKES on the go. So you can look up a client's clinical summary from your iPhone or your iPad. You can also, this is brand new as of this month, you can also get someone to electronically sign a consent form. So you don't have to have this almost this dance of having a physical consent form that someone's signing, as well as somebody else going into the application to attest that it's been done. This can streamline that process. So if you're interested in that, we have a great training webinar for that, as well as user guides and short how-to videos. The self-service console, this is how you log into the application, not log into the application, this is how you get your token. Tokens are used for all OMH applications, including PSYCKES. So new users have to use the self-service console, as well as our existing users, if they ever need to request a replacement token. It's all the self-service console now. We have great slides and training materials on that on our website as well. And then lastly, the help desk support. Help desk support is available 9 to 5, Monday through Friday. We give a response within 1 business day. If we have people on the line who have utilized our PSYCKES help desk, I'm sure they'll have nothing but nice things to say, because we really do try to help our users as much as possible. But if you are having an issue with logging in, or you need a replacement token, or you're a security manager who needs help with SMS, because those are for all OMH applications, you would need to contact the particular help desk that you would need. So if you're an OMH employee, you're contacting PSYCKES. If you're a non-OMH employee, you're contacting the health help at its.ny.gov. Whew, all right, so I know that we only have about 2 minutes left. I didn't realize we'd get so bogged down in the details, but Corin, do we have 1 or 2 questions that we can ask on air?
Hi, Kristen, we do. So we have someone ask, is there a way to tag clients to our large human services organization to a specific program? And if so, are we able to drill down for the matrix to see clients by particular programs?
I think I'm going to have to follow up with that question, because there's a lot to it. So we'll make a note to follow up with that person, because I need to dig in a little bit more about what the request is.
Okay. And then the last question, we have is, will third-party insurance data eventually be added to the system?
Oh, great question, and we sure hope so. So we're looking to get data all the time, and we're adding new data sources, as often as we can. So that is the goal, is to have, all available insurance claims information, including commercial and Medicare. Hopefully, having that in the future. That is definitely our goal, but not currently.
All right, thank you, Kristen. That's all we have for today.
All right, thanks everyone for joining. Really appreciate you taking the time. As I mentioned, the recording and the slides will be emailed to all of our attendees. And if you do have any questions about the application, whether it's the data or the functionality, feel free to please email us at the PSYCKES help desk at psyches-help@omh.ny.gov. Thanks again.